Over the last few days, 22 News has been addressing the recognition and treatment of melanoma, the deadliest form of skin cancer. Joining us live to answer your questions about melanoma, we have Baystate Medical Center Surgical Oncologist Dr. Richard Arenas. Dr. Arenas, thank you very much for joining us tonight.
Thank you.
And for helping me out with our series that I did earlier in the week. Tell me first, what are the treatment options for someone with melanoma?
So I think the mainstay of treatment still is surgery, because obviously someone with a melanoma, you think about excising that melanoma. But then a big part of the surgery is actually staging melanoma, which then leads into a host of other type of treatments.
When you say staging, what do you mean?
So melanoma, unfortunately, is one of those skin cancers that can spread or metastasize. And one of the first places that we look for spread of melanoma is to the lymph nodes. So as part of the surgery to remove the melanoma, we also will do a biopsy of a lymph node called a sentinel node biopsy to see if there's been spread of melanoma, because that would then open the door for a potential of other treatments out there, medical treatments that are really becoming more effective to treat melanoma.
Okay, and now we're talking about immunotherapy, right?
That's right.
Tell me what immunotherapy is.
So immunotherapy is actually where you apply or give medications that actually can change the immune system of the patient in a way that it actually will enhance its ability to attack the cancer and eradicate it.
So if you change someone's immune system, then their own immune system will attack the cancer.
Exactly.
That's what we're trying to do.
Right, and if you can effectively change it and leave it to that point where it would stay that way, you can actually affect a cure, even in stages of cancer that you would never think are curable.
Now, you had an example of that as well, did you not? I mean, that everyone seems to know about across the country.
Right.
Our former president.
That's right, because President Carter, Jimmy Carter, actually developed brain metastasis from melanoma. And it turned out that with immunotherapy, even given at his age, he had a complete response and actually has been cured from his melanoma.
I remember when we first heard about that he had brain cancer, that it seemed pretty dire. But that was already years ago, was it not? So he is cured.
Right. And I think that's the whole reason, because when immunotherapy works, it's actually changing your immune system. And if the immune system stays active, and it could stay active for as long as, as far as we can see, it could be for a long period of time, essentially you can keep a patient cancer-free.
All right. Dr. Arenas, thank you very much. We're going to talk a little bit more about immunotherapy in the 6 o'clock half hour. Thank you for joining us. And we will be, again, at 5:30, we'll be speaking with a dermatologist to help you recognize any melanoma that might be on your skin. And if you have any questions that you'd like answered, you can email them to us at reportit@wwlp.com. On the Health Watch, we're talking about May being Skin Cancer Awareness Month. And over the last few days, 22 News has been highlighting ways to recognize, prevent, and treat melanoma. And tonight, joining us live to answer your questions about melanoma, we have Dr. Jean Henneberry, a dermopathologist at Baystate Medical Center. Dr. Henneberry, thank you for joining us.
Hi.
Dermopathologist is different from dermatologist.
Right, correctly. I'm a pathologist that diagnoses skin lesions.
All right. First off, let's keep it simple. What is melanoma?
Melanoma is a cancer involving melanocytes. Melanocytes are cells that make up normal moles on our skin. And when they undergo malignant transformation, you develop a melanoma.
All right, so if you have melanoma, how do you recognize it?
Well, there are the A, B, C, D, E's.
Been hearing about that.
Stands for asymmetry, borders, color.
We're looking for irregularities.
Yeah. So with asymmetry, if you divided the lesion in half, if you kind of drew a line across it, one side would not look like the other. Borders, you have irregular borders. Sometimes they're scalloped. You couldn't draw a circle around it.
Right.
And then color variegation. You might have part of the lesion very dark. You might have another part kind of light tan. It's not uniformly colored. And then D is for diameter. So anything that's larger than, say, the size of a pencil head is something that should be looked at.
All right. Anything that's irregular.
And then E is elevation. Patients should be aware of their skin and anything that's changing on their body. If they've had a mole for years and it suddenly changes, then they need to get it checked out by their doctor.
All right, we actually got a question in from Dee on the internet. She wants to know, how can you find melanoma early?
By doing skin exams. And like I mentioned before, if you notice that a lesion is changing, you need to get it checked out by your primary care doctor, and if they're able to do a biopsy or send you to a dermatologist, then they can do the biopsy, and then I take over as the dermatopathologist.
That's what you do?
Yes.
All right, Dr. Henneberry, thank you very much for joining us this afternoon. If you have a question you would like to have answered about melanoma, you can just email us at reportit@wwlp.com. Over the last few days, 22 News has been highlighting the dangers of melanoma. We have invited Baystate Medical Center Surgical Oncologist Dr. Richard Arenas to join us to answer your questions. Dr. Arenas, once again, thank you for joining us. You joined us in the first half hour. I'd like to ask you about treating melanoma. You're a surgical oncologist, so I got to think first line of defense is surgery, and maybe surgery and chemo?
It's surgery, and then treatment afterwards would involve not necessarily chemotherapy, but immunotherapy, which does utilize drugs, but in a different fashion.
Now, immunotherapy is a way to attack cancers after it spreads beyond just the skin.
That's right. So when, skin cancers, mostly melanomas, have begun to spread or metastasize, that's a situation where you would use medical therapy because you would want to treat basically all of the cancer. So immunotherapy using certain drugs employs the immune system in order to attack and get rid of the cancer or melanoma.
So, I mean, if this goes to other organs, how do you know if it's working?
So I think that it depends on how you determine that someone has spread of their melanoma. If it's in the lymph nodes, many times we can assess that either surgically. Sometimes imaging studies, that's very helpful if we know that melanoma has gotten into any of one of our organs. And then it's by doing follow-up imaging after beginning treatment that we can tell if there's been a response.
Overall, you're getting better at this. You're getting better at detecting it, and you're getting better at treating it. This is kind of hopeful for a lot of people who might have it or anticipate getting melanoma.
It's amazing that, I would say, within the last 5 to 10 years, immunotherapy has really taken place and really has shown really good, very promising results. I think that what you're seeing now is that there's refinement of those type of drugs, and I think people are learning more about the body's own immune system, and they're really using that as the ability to get rid of cancer.
I got to think there's been a lot of awareness surrounding melanoma in particular. There's a lot of skin cancers, and I think people are looking for it and they're finding it earlier.
I think that's true, but I think that the problem is, and this is something I've been saying lately, is the fact that I guess I'm amazed at the number of people who have melanoma, and yet they go to see their doctors, and yet they don't get diagnosed soon enough. And I think that what I try to tell people is you have to be your own advocate. If you think there's something on your skin that you don't like, insist that your doctor see it. And I tell other people, if you go to see your doctor for a checkup, disrobe. Some people just don't get out of their clothing when they go to see their doctor.
Check it out, check me out.
That's right.
Be the doc's boss.
That's right.
Dr. Arenas, thank you very much for joining us today and for helping us out this week on Melanoma Awareness Month. And of course, you can still email your questions to us at reportit@wwlp.com. We also have information about melanoma on our website.